Warm good evening. I am Dr. Shabir Muhammad. I work with the government of Kerala and I am practicing as a nephrologist. I work in General Hospital, Alappuzha, which is located in the south of Kerala. Today, I will be discussing on edema. You may be familiar with the term edema. Actually, a lot of people approach nephrologists with complaints of edema. Lot of people are worried whether they are having any complaints with their kidney because people often equates edema with kidney disease. So what do you mean by the term edema? Edema means swelling of your extremities, and this swelling is caused by collection of the fluid beneath your skin. How does this edema occur? In order to understand the mechanism of edema, you have to be familiar with the circulation of blood inside the body. In our body, heart pumps blood to various parts of the body with the help of arteries. Arteries are stiff blood vessels which helps to pump blood from heart to various part of the body. And this artery divides to form small blood vessels called capillaries. This capillary has got very thin blood vessels such that the nutrients as well as oxygen will ooze out from this capillaries, and that will help to nourish the body with the nutrients as well as oxygen. And the venous system collects this blood from the capillary system back to the heart. So there are situations in which there is the pressure will build up in this venous system that will cause an increase in the pressure inside this capillary, that will cause more fluid to leak from the capillaries, and this will lead on to an collection of the fluid besides beneath the skin, and this will manifest as edema. This is a situation where which you can get edema or swelling of your extremities. There is another situation when the capillaries will be leaky because of some trauma, infection, or inflammation that will cause leakiness of the capillaries, and this will produce edema. So whenever a physician or a nephrologist see a patient with edema, they will classify this whether the edema is due to some common conditions which can be seen in every day-to-day life, such as if the patient is standing for a prolonged time or sitting for a prolonged time. This can lead on to buildup of pressure inside the venous system of the lower limbs, and that can lead on to edema. Or whether the patient is pregnant, or the patient has taken a long walk, or such and such causes are not due to any disease. This can occur in normal individuals also. In other situation, the doctor will look whether the edema is localized to a particular limb or not. Such situations can occur in local causes, such as in inflammatory conditions, such as in the infections of the lower limb, such as filariasis, cellulitis. And it can also occur when your veins are blocked with a venous blood clot. And this has to be identified as early as possible, because a venous blood clot can dislodge your heart and cause sudden cardiac death. So this is another situation where you can get edema. Another important cause of edema is varicose veins that can produce venous insufficiency, and that can lead on to back leak of the blood to the capillary system, and that will cause an increased pressure inside the capillary system, and that can cause edema. Depending on the venous insufficiency, you can get bilateral or unilateral edema. Another uh, important cause of edema is due to involvement of the systemic circulation. Systemic circulation involvement can occur either due to the systemic conditions such as cardiac failure, liver failure, or renal failure. First, we will discuss on the edema due to cardiac failure. Edema can occur in heart failure just because of the fact that there is an increased filling pressure inside the heart. That is produced by the inability of the heart to pump blood from the heart. That will lead on to increased pressure inside the chambers of the heart. Another important cause of edema is due to the involvement of the kidneys. Whenever there is a kidney failure, there is accumulation of the fluid inside the body, and this accumulation of the fluid inside the body can lead on to the excess pressure inside the capillary system that will lead on to edema. And in that, the same thing is also happening with the liver failure. There is excess accumulation of the fluid inside the body due to the accumulation of the salt inside the body. So what can we do when there is edema? The most important thing which we can do is you have to restrict the fluid intake, and you have to restrict the salt intake. Whenever there is an increased salt intake, there will be accumulation of the fluid inside the body due to excessive thirst. And when you are reducing the salt intake, that will automatically decrease the thirst, and that will lead on to decreased fluid collection inside the body. And when you are dealing with a local cause of edema, such as the edema due to prolonged standing and venous insufficiency, elevation of the foot as well as the compression and the pressure application will be somewhat helpful in reducing the edema. Also, you have to identify whether the edema is due to any disease process as such or it is physiological. For that, you may have to approach a doctor, and so that he can do sufficient appropriate tests, and he can find out whether the edema is due to some disease or not. Another very important cause of edema is usage of certain drugs. The certain common drugs which can produce edema are antihypertensive medications such as amlodipine, cilnidipine, etc. And certain anti-diabetic medications such as pioglitazone can also produce edema. Most of the time, by stopping these drugs, the edema will be get resolved by itself. So it is also very important. So you have to be ready with the drugs you are taking when you are approaching a doctor with edema. That's all for today, and thank you for your patient listening. Thank you.